Hi, this is Dr. David Tenner of the Goldberg Clinic for Chronic Disease Reversal. Today I'd like to present an interview with a patient that we've been working with for the past year. The patient came to see us with a medical diagnosis of rheumatoid arthritis. The following interview is a detailed account of the patient's experience with us at the clinic and the significant improvements that she has seen while under our care.
Good morning, this is Dr. Paul Goldberg at the Goldberg Clinic. I'm here with Ms. Holly Knocknagel today. Holly, you're from?
Chapel Hill, North Carolina.
Chapel here in North Carolina. And Holly came to us about a year and a half ago?
Mm-hmm.
About a year and a half ago. And she was suffering at that time with?
The beginnings of, rheumatoid arthritis.
With rheumatoid arthritis. What was your situation at that time, Holly? What were your symptoms and how were you feeling?
Yeah, what sent me to the doctor was one of my fingers had swollen up and was getting really, really painful. Mm-hmm. So I just tracked it down, and then I found out that I had all these other symptoms that I had been unaware of.
Mm-hmm.
And I think now that, of course, they were all related to that.
When you were at your worst before you came to see us, what was your condition like?
Well, I was way overweight, 50 pounds overweight, and I couldn't walk very well. My heels had contracted so that I couldn't go down steps alternately. I was taking them one at a time. I couldn't, like I said, couldn't walk more than maybe 100 feet without just being exhausted. I guess I had a lot of constipation also.
And how much general stiffness and joint pain were you having?
Total. I mean, it was like everywhere.
You went to rheumatologists at the time, you went to doctors at the time, and what did they do for you?
Nothing. All they wanted to do was hand me methotrexate is the drug that they wanted me to get on, and I tried talking to them about why this was happening and what else I could do, and would get nothing. Nothing. They had nothing for me. They didn't know a clue. I mean, it was like talking to a wall.
So that must have been very frustrating.
Absolutely. And in fact, I went from one doctor to another who did research just in hopes of seeing if they had anything, more relationship with me to figure out how to deal with this rather than just handing me a pill.
Sure. And so somewhat desperate and frustrated, you then came to us and we did a workup on you. And just tell us, if you would please, what improvements you've had by not being, we didn't treat you for rheumatoid arthritis, we don't treat anybody for any disease here, but by doing a workup on you, finding out what was wrong, and setting on a natural course, not through treatments, but by establishing the right conditions for health, what kind of improvements have you had?
Well, I lost 50 pounds, and I went from feeling like a 90-year-old woman to being able to ride and walk 2 or 3 miles and drive. I couldn't drive more than 40 minutes without being so stiff that I couldn't hardly get out of the car. So now I drove down here 6 hours by myself, and I can walk 3 and 4 miles up a mountain a few weeks ago, a 2-hour hike. And not breathless, not sore from that. I'm riding again. I'm riding about an hour or 2 every month, and do get some normal soreness from that, but
well, certainly nobody would know now that you have rheumatoid arthritis.
Nobody knows unless I tell them.
Unless you tell them. And would you say your disposition has improved?
Yeah, I'm
We're seeing a lot of smiling with Holly.
A lot less depressed and fearful and
so without putting any words in your mouth, would you say now that you have more control of your life?
Absolutely.
Okay. And this is one of the most important things, rather than go to any doctor to get pills and drugs that have harmful side effects, to enable people to make health care self-care, where they can start taking control over their own lives. And now, Holly, we haven't seen you for 7 months. 7 months, and so we are returning control of Holly's health back to her. And Holly, do you have any suggestions for people that have these rheumatoid conditions?
Diet and nutrition.
Diet and nutrition.
It's so total,
okay.
And it's hard, but it's absolutely doable. If I can do it, I know anybody can do it.
And we have to, of course, individualize a plan for people. Nutrition, as Holly knows, is not just what we eat, but all the factors are involved with knowing the right things to eat and making sure that food is digested, absorbed, and assimilated right, that waste products are excreted and eliminated, so we can have a healthy, efficient metabolism. So we want to encourage people out there that are suffering from any type of autoimmune disease, rather than, including rheumatoid arthritis, as Holly was diagnosed with, that there is help, but we have to be willing to, as Holly did, work hard, take control of our own health, getting the right direction so we become independent, again, making healthcare into self-care. Thanks, Holly.